Hello, everyone. Thank you so much for being here. I know this has been a wonderful day, and I'm honored to be the last in this wonderful lineup of speakers today. My name is Sharonda Davis. I am a registered nurse. I have been a registered nurse now for the past 18 years. Most of my career has been in critical care nursing. However, right now I'm a travel nurse traveling from state to state and hospital to hospital, working in various areas. I'm a mother and I'm also a wife of three wonderful school age boys, which in turn makes me a futurist. I'm a futurist because I'm interested in their future. As a matter of fact, my youngest son's interest in art and NFTs is what led me to be interested in Web3. About a year and a half ago now, I fell down the Web3 rabbit hole after learning about NFTs. I then went on to complete a course with the RIM Foundation. I was also a member of the very first cohort of Mission Impact Global Leaders. I'm an ambassador for the Web3 equity community in Miami. And most recently, I'm a fellow of the Knight Foundation's Health Innovation Fellowship at Baptist Hospital in Miami, Florida. Today, I'm here to talk to you about decentralizing healthcare and exploring the future of healthcare and the impact that Web3 would make on that. Now, I have been in healthcare for almost 18 years. And like I can say, we all know that the way you're treated in the hospital often depends on who you are, where you are, what type of insurance you have. My commitment to decentralization in healthcare is because I want to see that change. My mission, my vision, one of my earnest desires is for everyone to be able to receive quality healthcare, no matter who, where, or even what they are. So let's get into it. I also want to mention that I'm the co-founder of the Huddle Down. By the end of this program, if you're a nurse or you know a nurse that's interested in learning more about Web3, please direct them to our website, thehuddledown.com. We are empowering nurses to move and work in this Web3 environment. Let's get into the presentation. So, what is decentralization in healthcare? Decentralization in healthcare is a process of distributing the control and management of healthcare services away from centralized authorities like hospitals and insurance companies and shifting that power, giving more autonomy and flexibility in the healthcare system to the patients and the providers, the ones that are affected the most. Decentralization allows for more efficient and cost effective services. The potential impact of decentralization in healthcare includes increased efficiency, improved accessibility, and enhanced interoperability. As far as increased efficiency is concerned, by eliminating centralized bottlenecks, all providers, especially physicians, know how long it can take to receive payment for services, and patients know how long it could take for services to be approved. This is a major, major barrier to healthcare for many, especially the uninsured and those that just don't have enough money to pay for healthcare. By eliminating centralized bottlenecks and empowering patients and healthcare providers with direct control over data, processes, and decision making, decentralized systems enable streamlined workflows, faster information exchange, and a more agile healthcare delivery. It also allows for improved accessibility to healthcare by using things like telemedicine and mobile health applications and decentralized platforms, or also known as DApps. Individuals can access healthcare services regardless of where they are in the world. I mean, this is groundbreaking. The possibility of global healthcare, it's so exciting to me because for years, I feel like people in rural communities have often missed out on quality healthcare just because of their location. Blockchain allows for improved accessibility for everyone, no matter where they are. Enhance interoperability. This is a big one for me because we all know you can go to this hospital on Monday, and God forbid on Friday, you have to go to another hospital. It's unfortunate that the way hospitals communicate today don't allow for the hospital you went to on Monday to communicate with the hospital that you go to on Friday. Oftentimes, they don't even know that you were in the hospital. This is a great concern, especially when you think about our aging population that oftentimes are suffer due to poly medications, poly prescriptions. I'm sorry, but there's a word that describes when you have so many different prescriptions coming from so many different doctors, and no one is keeping up with the interactions. My last contract, I was in the ER, and I can't tell you the number of elderly patients that I saw coming in, and the majority of the time they had taken too many blood pressure pills, or maybe they took their pain pill in addition to their blood pressure pill. These types of things cause major health concerns, and as we have more older adults living alone, managing their health on their own, these things like enhanced interoperability are going to be wonderful once blockchain technology is able to identify, organize, and control how patients are receiving these prescriptions. So decentralization has the potential to revolutionize healthcare by increasing efficiency, improving accessibility, and enhancing interoperability. Let's take a look at some of the blockchain applications that are already in use. Medical chain. Medical chain is a decentralized system that uses blockchain technology to securely manage electronic health records, allowing patients to have greater control over their data. Here is, I would like to show you a brief video.
In our world today, with the technology available, could healthcare be better? Today, doctors, nurses, and health professionals are limited in the level of care they can provide. This is due to the inability to view your complete and accurate health record.
At Medical Chain, we believe that by putting patients at the heart of healthcare, we can truly improve people's lives.
With Medical Chain, you have full access and control over your own personal health data. Users are able to grant doctors immediate access to their health record via their mobile device. Medical Chain keeps electronic health records safe and secure using blockchain technology. The blockchain layer of Medical Chain hosts limited, non-personal information. This information acts as a pointer, directing the system to your encrypted health record. Encrypted records are held within hospitals, universities, and nonprofit organizations regulated to handle sensitive data. Only your authorization can unlock your health record and allow it to be viewed on the mobile interface. But Medical Chain is much more than a way to view patient electronic health records. Services such as telemedicine consultations are available with Medical Chain. Your doctor can check your progress with access to your medical history. Wearables ensure that doctors can access life-saving information when managing vulnerable or unconscious patients. Medical Chain provides peace of mind. You can feel safe knowing your health data is accessible to you and your doctor when it matters most. We are transforming healthcare with health professionals, patients, and technology specialists from around the world. We hope you too will join Medical Chain in building the healthcare of tomorrow today.
Medical chain is one of my favorite use cases of the blockchain. I do believe that once patients are allowed to control their health data more, this will also help with preventative care. I believe if we could monitor our own health and have responsibility for our own health more, if we had control over our labs and our EKGs, where these things went, who had access to this, what we're able to do with this could even monetize patient data. A lot of research is done based on patient data, and patients oftentimes have no clue that their data is even being accessed or used in this research. So Medical Chain offers patients the ability to control their own data, and I think that this is a phenomenal use case for the blockchain. One other current very this is and we this is a topic that we often talk about is consent to share, and that's what I was just talking about. Oftentimes patient data is used with or without their knowledge. Consent to share is a platform that leverages blockchain's immutability and transparency. It ensures that patients consent decisions are recorded in a tamper-proof manner, providing a reliable audit trail for research ethics and compliance purposes. This decentralized approach helps address privacy concerns, it enhances patient control of their data, and it streamlines the consent management process for both patients and researchers. One other use case that, and this is the one that I find the most fascinating and that I look forward to the most, is med credits. I don't talk about this a lot, but my mother is a retired nurse, and prior to his death, she cared for my father in our house for 10 years at home by herself. Oftentimes, access to healthcare in the home was very limited, just because if your insurance doesn't cover home health care, oftentimes you don't receive home health care. So thank God that she is a nurse and was able to provide him with such excellent care. But I'm excited about the possibility of platforms like Med Credits. Med Credits is an actual medical blockchain, for lack of a better way to describe it. It's a decentralized telemedicine platform that uses blockchain technology to connect patients with doctors worldwide, making healthcare more accessible and affordable. This to me will be how blockchain allows for global access to healthcare. If there was a way that if I have this token and the provider takes this token and we can have a peer to peer exchange through the blockchain, that takes away many of the middlemen that slow down healthcare today. I mean, I know that we are so early. This is so far off. Everyone knows that healthcare is the last industry to accept new technology. I remember being a nurse back in, I think, 2010. Um, the internet had been around for years already, and we were still using pen and paper at work to document. I think it wasn't even until 2012 that most hospitals were fully using electronic medical records. And believe it or not, many hospitals to this day are still using paper and pen to document. So I don't believe this is something that will happen in the next year or even in the next 2 years. But I do believe that as regulations and laws allow, as HIPAA concerns are addressed, and as blockchain technology continues to improve, I do foresee a day where there is a medical blockchain that allows us to have access to healthcare no matter where we are or whether or not we have insurance. I do want to show you what that would look like. Some I've been asked, oh, not that. Sorry. I do want to show you what this would look like in real time. Like I said, I don't think it'll be that long, but I do know that we're early for this. But here is a look at med credits and how it would work, how having this on demand access via the blockchain healthcare. This is how that would work.
What's up, party people? My name is Daryl, and today I'll be showing you how to use the Slider Revolution plugin for WordPress. Now, this slider is incredible. You can add some really amazing features, you can add some animations and graphics, and in this video, I'll be
Sorry about that. But yes, I hope you saw how easy that was to simply upload a picture, pay for it with credits. There they were using the MedX credits. I imagine there will be many different tokens in the future that you'll be able to use based on the providers that you want to have access to. Those providers will receive that token, you will purchase that token, and that's how you'll pay for medical care. I mean, to me, that's fascinating to think that a day will come where I could become a member of this platform, this ecosystem, simply by purchasing this token. I could have access to worldwide healthcare. I know that it seems adventurous, but I really believe in the ability for blockchain technology to remove the middleman and allow everyone to have access to quality health care. As a nurse, it means so much to me because, like I said, in the hospital, we all can attest a person without insurance oftentimes does not receive the same quality of care that people with insurance receive. And not that this is the end all be all, but it is definitely a way to make healthcare more accessible. And like I said, as our populations continue to age, as hospitals continue to suffer, especially in rural areas, I think that we should all start to look towards the blockchain for some possible solutions to these problems. I encourage you all, take a look at these different platforms, med credits, medical chain, consent. There's so many other I think there's patient Tory. There's so many different blockchain applications that are being built around healthcare to solve for the problems that currently exist. Please take time, explore them, research them, provide your feedback. As co-founder of the Huddle DAO, what I do is empower nurses. I teach nurses as much as I can about Web3 and blockchain technology so that when the day comes that these technologies are available and in use, nurses will be prepared to take part in this ecosystem. Nurses will be prepared to give their feedback, and they'll also be prepared to treat and care for patients using a whole new system. So I hope this was beneficial. I am going to, in conclusion, just say that decentralization in healthcare is not just a concept, it's a transformative force that can revolutionize the way we deliver and experience healthcare. By embracing decentralized model, we can put patients at the center of care. We can enable seamless collaboration among healthcare stakeholders and harness the power of technology to improve patient outcomes and experiences. Now, I know we all have our concerns about blockchain. Every day there's a new scandal, a new theory, but I please remove all of the conspiracy and all of the scams and think about the technology itself and the ability that it has to change the world. Thank you so much for your time. I'm honored to be here today in this wonderful lineup. Again, I'm Sharonda Davis. I'm a registered nurse. You can find me on almost every platform, Instagram and Twitter as NFT Nurse. Here is a QR code that will take you directly to the huddledown.com. If you have nurses in your family or as friends that are interested in Web3, please direct them to the Huddle Down. Thank you so much for your attention. And I do hope that you'll give decentralization in healthcare just a little more thought. Thank you.